Hi, good morning. My name is Dr. Raja Adnan Ahmed, and I am a psychiatrist working in UK. And with me this morning, as I got Dr. Shaheryar Khan, and Shaheryar is also from Pakistan and IMG, who's currently working in UK. Uh, the reason I invited Shaheryar was to actually talk about his experience as IMG of getting ophthalmology. A lot of IMGs have this misconception that surgical specialties are very difficult to get in the UK, and it's something that they shouldn't be trying or be too hard. I think Sharia is a good example. Sharia came to UK in 2014, and now he's working. He's going to start his ST training, is ophthalmology. So I thought it would be a good idea to ask him about his experience and how he managed to do that. So first of all, Sharia, thank you very much for joining me and giving me your time.
Yeah, thank you very much. Good morning, and thanks for having me.
So Shayar, if I ask you about your journey so far as an IMG in UK, would you like to share some of that?
Yes, absolutely. So as you mentioned, so I came in 2014, and interestingly, I did not come directly from Pakistan. So from Pakistan, I went to Ireland, which is a Republic of Ireland, Southern Ireland, and I worked there for an year and a half in ophthalmology. And the only reason for that was that I wanted to come to UK, but I was a bit stuck with my PLAB exams. So in the meantime, I got my Irish registration. I went there, did a year and a half, but ophthalmology is very competitive in Ireland. I think much more competitive here. So let alone the training posts, even non-training posts are very difficult to secure in Ireland. So I worked there for a year and a half, and I realized I have better chances and opportunities to grab in the UK. So I got my PLABs out of the way and then came to UK in 2014. So by the time I was here, I already had something like 3 years of ophthalmology experience. So I was kind of relatively experienced. So because of that, I secured a permanent post, which was a specialty grade. So I worked on that for over 5 years, and then well, almost 6 years. And then in the meantime, I mean, initially I was not thinking too much about training, and I didn't have a lot of good feedback, or you could say advice about how to get into training or whether you should or should not. But eventually I got to meet some people. I got to know about some good experiences, and then I decided to work on my CV and resume. And then eventually last year I got into ST training. So I've just had my ARCP, the first one. So overall, yeah, it was, I entered the training a bit late, but I think it's still useful. I'm quite happy.
And what was the experience of getting the ophthalmology training? Because that's important for people to understand. What is the recruitment process like?
Yeah, so basically, I think it's quite fair, very structured, and I think it's all really point-based system. So in a lot of specialties nowadays, it's all point-based system. So in older times, you would sit in front of a person and he would ask you different things and he would judge you, and then he may or may not take you there. All those kind of things are gone now. So in ophthalmology, it's the same. So you have your portfolio and your actual interview. So for us in ophthalmology, every year the weightage of both these things vary. But in my time, when I sat it last year, the interview weightage was a bit more. So it was about 60% roughly, and about 40% was your portfolio. But again, your portfolio has even 40% is a lot of weightage. It kind of changed this time around. So this year, the people who got into ST3 or 4 level, they had about half and half, so like 50% weightage of interview and 50% of the your portfolio. So I mean, obviously, I can talk about portfolio, what you need, what you want to do, but
I
the
think
actual, yeah,
yeah, I
sorry.
think it would be helpful if you can explain a bit more about portfolio. That if somebody
Yeah,
would.
so basically, I mean, it's all there on the Severn Deanery website, and I think Royal College of Ophthalmologists has some details as well. So what happens is on the actual interview, I think 3 to 4 months before that, the recruitment process opens up, and they give you all the details. They tell you that, after this and this date, on a specific date, you're going to have the interview, and they give you all the details about what you need in your portfolio. So they tell you, and the basic things you need in your portfolio is you need to have some research or publications. You need to have some quality improvement activities or a clinical audit, preferably a closed loop audit. And these two things really bump up your CV or your portfolio, let's put it like that. The third thing, which I think is really important in your portfolio, is if you've done any master's type of degree, whether it's a research master's or a master's in ophthalmology. So we're talking about some kind of a master's or MD, or if you've done a PhD, then you will get loads of points for that. A lot of people don't do that, but if you've done some kind of master's, that will be helpful. If you have done any e-learning tool, e-learning course, or if you've designed an educational course, that will give you points. Apart from that, it really depends where you're entering the SD ophthalmology. So if you're entering at SD1, you probably don't need a lot of prior ophthalmology experience. But if you're entering at a higher level, which was the case myself, SD3 or 4, if you have done some surgery or some other procedures in ophthalmology, like some lasers, etc. It's going to be too much detail at the minute, specifically what you need, but things like if you've done cataract surgery, a certain numbers, then that for all of that, you gain points and you score points. So you have additional points. So sometimes when you look at the requirements of portfolio, how it's designed, you think, okay, well, you're entering ST3 level, but they're asking you, some the things they're asking you is almost like what they need to become a consultant, PhDs and all those kind of things. But not everyone does that. But whatever you do, it just helps you. On the day of interview, it's almost like, I would call it it's like an OSCE. So it's almost like a mini exam rather than an actual interview. And you have 4 stations in it. And it's exactly the same whether you are SD1, entering into SD1 or SD3. And the 4 stations are, first is clinical skills, where they can give you different scenarios. They show you pictures nowadays, or they can show you on iPad some pictures of ophthalmology clinical problems. And then they can ask you random questions, which could be on investigations or treatment. So that lasts for about 10 minutes. And then another 10 minutes is your quality improvement activity stations, which is the second one. So they can give you either a audit, or they can ask you to do a QIP. So they give you something like 5-10 minutes to prepare at the time of interview. So they give you a task, you have to prepare it, and then they give you another 10 minutes, and then they would ask you questions. How would you design this this audit? For example, if someone wants to have drops in their eyes, and you want to know how much the drops you put in your eyes. I mean, anything of random point. How can you improve that? Or it can be something else, that in the clinics, there's a big backlog of pediatric patients, and how can you improve that? So they can give you any task, and you have to just formalize the structure and do it in 10 minutes, and then you're marked on that. Thirdly, you have comms station communications, and that's quite an important one, because people don't score that well in that. And normally in that you have an actor, and he is given a task, you are given a task, obviously, and they give you some kind of a scenario. Usually it's a clinical scenario, and mostly it's breaking bad news, but it could be, around anything. For example, I remember in my scenario, there was a patient who had a retinal detachment where the retina came off, and they were referred from an optician, but there was a bit of a delay. So you had to counsel them and communicate with them what was the reasons and what's going to happen, etc., etc. So that really is a very small time, and you have to, do everything in that time, and you have to satisfy the patient, and you get again something around some 10 minutes or that for it. And if you do well, then I think you will have an edge upon others, and you'll have more chances of scoring more in the interview. And the only way you can improve that, or in fact, all of them, is by practicing and really preparing for the interview, rather than just going in, without any preparation. Lastly, critical appraisal of a research paper. So they can give you a randomized controlled trial or a cohort study or a retrospective study, anything. But mostly it's RCTs. Again, in ST3 level, it is all ophthalmology, whether it's QIP or critical appraisal of a paper, it would be all ophthalmology. But if you're entering ST1, they can sometimes give you something else. So it could be non-ophthalmology as well. For example, MRSA, they might give you an audit to do that. But if you're entering ST3, then it would be all ophthalmology. And so they give you, so for the fourth station, critical appraisal, they give you about 20 odd minutes to read through a paper. And you have to read through a paper and you have to think about what could be the questions. You have to critically appraise that paper in that 20 minutes. And then sometimes they give you tasks, questions, and they then ask you exactly the same questions what were given in the task, that what's your answers. And that includes statistics as well. So you should have a good in-depth knowledge of statistics, for example, chi-square, or they might ask you, how can you, what can be an odds ratio in that, all these kind of things. So I think overall it's quite structured, but you have to really prepare for it, whether it's portfolio or your actual interview. But if you go in without any preparation, I think it's almost, it's almost hard to get or secure a job. So overall, ophthalmology is competitive, but it's doable if you prepare well.
It's a very extensive interview process. I've seen other interview processes. I haven't seen the people having that long. Obviously, clinical stations are normally part of other stations as well, but I haven't heard people critically appraising papers and coming up with other ideas around audit and quality improvement. I think that requires a lot of prep, and also they also score you on your portfolio as well, which is something that you need to start doing in advance.
Correct. Yeah, and the other interesting thing which is quite relevant in this era is because of the pandemic, this time around, they only did interviews on Microsoft Teams virtually. So in the interview, the only station which was kept was the comm station, communications. So they scrapped everything else. So this is why communications is quite important. So it was the only station, because it's very hard to judge you or virtually test you for clinical stations or anything else, or critical appraisal. So communications is quite important. And that's the one which, I have my very close friends who couldn't get secure good marks just because they were very deficient in communications.
So if an IMG is thinking about ophthalmology, and they are maybe right now sitting in the home countries, India or Pakistan or other countries, or they're already in UK working on some other jobs, what is your advice to them? If they want to consider ophthalmology, what should they be doing to improve their chances?
Yeah, first is they have to understand the process, how it works, and what you need to do about it. And there's lots of resources. So I think you have to do a bit of research. So there's Royal College of Ophthalmologists website. You can look up on that. And then there is the recruitment website, which is Severn. So you can look up things on that. And sometimes they take away that, the details for that particular year, but there are some archived things still on Severn, so you can still pull out lots of information. So I think firstly, understand how the process works and what is expected of you. And secondly, I think you have to first decide whether you want to enter ST or not. So, there's always two options in the UK, whether it's ophthalmology or anything else, that you can enter either an ST program and then get your CCT and eventually become a consultant, or option number 2 is you do Article 14 CSER. So you have to think, what stage are you? If you're really experienced, like 6, 7, 8 years, or maybe 10 years experienced, ST might not be a good option for you, but again, at the same time, it might be. So I always think, and I might be biased, but I always think, and this is why I've done it, that it's always good to be in a formal training program and achieve a CCT and then become a consultant. So I think you have to think on those lines. And then I think you have to really prepare, go in, with a very good preparation. And an important thing also is, I think there's a lot of, I don't know whether you call it a mental block or your own, psychological block where you think you cannot get into surgical specialties, and ophthalmology is one of them. It's highly competitive. So in my round, we had only 20 seats across UK, which is quite competitive. And from one aspect, one might think, okay, it's almost impossible. But I mean, if I can do it, then anyone can. And this time around, again, there were less seats. There were 15 seats. So approximately every year, they have about 100 to 105 seats, which are distributed between ST1 and ST3 recruitment. So approximately, I would say 80-ish for ST1 and about 20 for ST3, but it can vary. So it can be 85 for ST1 and 15 for ST3, but you could say 15 to 20 for ST3. So you have to be really well prepared. For the portfolio, I would say for anyone who wants to do that, they should start working on that about at least a year, but ideally 18 months or even 2 years before. They should have some papers. They should have some audit loops. I think if they've done an MD or something, that will help them as well. And it could be anything. It shouldn't be ophthalmology. You can do an MD in medical education or research, anything that will give you points. It's the same for publications. It does not have to be in ophthalmology journals, a publication anywhere in a good impact factor journal. And Site Factor is the website they refer to. So if there's any journal who is on Site Factor, they'll consider it and they'll give you points for that. And then if you've done educational tools, etc., that will give you more points. And then I would say probably it's my experience as I prepared for about roughly 2 to 3 months, almost 2 months for the actual OSCE. And I took it almost like an exam. And I know a lot of my friends who were specialty grades and they were trying to get into ophthalmology, but their take on that was, okay, well, we'll just apply, we'll sit it and just try our luck. And if you don't get it, then we'll just continue with whatever we are doing. I think if you're going to go with that mentality, you're most likely not going to get it. So you have to prepare well.
So how many years of training are there on ophthalmology? Because you are ST4 now. So how many more years left?
Yeah, so I'm finishing ST4, so I'll be ST5. So total ST training ophthalmology is a run through, and there's 7 years, 1 to 7. So you can enter either ST1 or ST3 level.
What about the exams? How many exams do you need to do in when you are in the training?
Yeah, so there's only one exam, which is called FRC Opht, or the full title of the exam is Fellow of Royal College of Ophthalmologists, and that's the exit exam. Unfortunately, it's a bit different from other surgical specialties. So I would say, I don't know, 10, 15 or 20 years ago, there used to be an intercalated kind of an exam that you could have done any FRCS ophthalmology exam. That does not happen anymore. So they've stopped that. So there are international FRCS exams of different colleges like Edinburgh, Royal College of Glasgow, and Ireland, but none of them are accepted for the formal structured UK training or for CCT. So the only exit exam is FRC Opht. And unfortunately, it does not give you any exemption from any other exam. So if you've done, like, for example, so in my case, I had FRCS Edinburgh. So I was doing that. So it didn't give me any exemption. So I had to sit the FRC Opht from the very first beginning part. There are 4 parts of the exam. Part 1 is your basics and very basics of ophthalmology, which is biochemistry, physiology, and there's something called optics and refraction. And it's all a paper-based MCQ exam. Part 2, you can say, or the second part is refraction certificate, where there is a skill of refraction where you do pretty much the same what an optician does if you've ever been to an optician. And that's quite an extensive one. Again, that's all a kind of clinical exam on patients. Third one is all clinical ophthalmology, and that's all written part, or you could say MCQ part. And the last one, which is the final part, is where you have Viva and OSCEs on the real actual patients. And once you've done that, then obviously you have to do it, the final part before ST7.
Okay. And the other thing I wanted to ask you, which a lot of common question for IMGs, you know, what is the life like as an ophthalmologist? You know, what do you sort of, how many um, clinical hours you do, what else you get to do in while you are training, and when you become a qualified doctor, how many operation theaters are you doing, and how many clinics are you doing in your routine work, and
Yeah.
we won't have understanding of what on calls look like, or
Yeah.
what does the clinic look like in your
Yeah.
specialty.
So ophthalmology is one of those specialties which has a really good work-life balance. And I think that is one of the reasons why it makes it so competitive, because most of the UK graduates, they want to enter ophthalmology. One of the reasons is because of the same fact that you have a very good work-life balance. And second is there is a good chance of or you could say for private practice. So, for example, cataract surgery is something which is a bread and butter of ophthalmology, and you can make a lot of money. So, I mean, obviously, we're not discussing financially, but that is one of the reasons that, I mean, I know in my previous hospital where I was working, one of the ophthalmologists was the biggest revenue maker in that particular hospital, and he was an ophthalmologist from his private practice. Generally, you have a good life-work balance. You work something like, again, 40 to 48 hours. Again, it depends on your calls, on calls, different things. You do not do any resident on calls as a trainee or even as a consultant. So all you do is a non-resident on call, which means when you're on call after 5 or whatever, after 5:30, then you would stay in the hospital. You'll see whatever patients are there or whether they've been referred. And if you don't have any patients or if you've seen the patients, then you go home and you don't come back unless you're asked to. So if there's a real emergency or a real problem that cannot be sorted or that cannot wait till the next day, then you have to go in and see that patient. Otherwise, you don't have to be there. You don't have to, sort of abandon your family and go and do that. So that is one thing which is, again, which attracts a lot of people. But again, all of us are different. Some people like to work on site. The downside of that, though, is because you're working non-resident. So as a trainee, you are not given that much of banding. So your actual salary is a bit less than what you can earn as a medical trainee or whatever, emergency medicine or something else. So that's one thing. The other thing is after when you have become a consultant, then you are second or third on call, which means your on call is really, really chill. So the first on call, whoever is your trainee will deal with it, or if you have a fellow, they'll deal with it. And if there's anything that cannot be dealt with by them or they need your input, then they would bring you or ask you for an advice. Very rarely, again, it depends on where you are, but if you are in a really, really busy center, then even your on call as a consultant can be a bit busy. But generally speaking, it's not too bad. So I think you have a good life. You come back home about 6-ish, if you're in a very big center, maybe 7-ish, but you're not bothered too much. So I think overall, that's one of the reasons people want to go. The other thing is ophthalmology is one of those specialties where you can do medicine as well as surgery kind of combined in one specialty. So you can do a lot of medicine and then you can do surgery, and it's now become highly subspecialized as well. So there's in ophthalmology, there's about 10, 11 subspecialties. So you can choose to do whatever you want surgically. And then there's another thing now, which is called medical ophthalmology, which is what means if you do not want to operate, or if you don't feel confident, or if you think you're not good at it, you can just become a medical ophthalmologist and, just leave anything which is more demanding or challenging. It doesn't mean you have to, but that is another route. So, and then coming back to your question about roster or your timetable, I think as a trainee and as a consultant, both you get 2 sessions for surgery. Again, it depends. As a trainee, you would have one cataract session, theater session, and the other one would be a subspecialty training session. If you're a consultant, then whatever your specialty or subspecialty is, for example, if you're corneal, then you probably have both corneal cataract, corneal theater with some cataracts in it, or if you are a glaucoma, you might have glaucoma session. But generally speaking, out of 10 sessions, you have 2 theater sessions. You have 2 administrative and RSTA type of sessions where you can study, research, and do all of those things. So that makes it 4. Generally speaking, you have one teaching session on top of it, where if you're a consultant, you lead the teaching, or if you are training, then obviously you have to attend the teaching and present. And the other 5 are your direct clinical sessions where you would be in the clinics. So overall, it's quite a good balance.
Thank you very much for joining me and giving us all this useful information. I'm sure this will be very useful for people who are actually looking at ophthalmology as a future career.
Yeah, definitely. Yeah, I would probably, the last thing I would say is it's very much doable. And I mean, you have to just find the right people and get to know the people who have done it, and ask them those questions. And it's the same story with me, that I did not find the right people initially, but then I met a few people who did it, and then you have to have a belief, and it's competitive, but it is doable. It's not impossible. So all the best to everyone who wants to pursue this.
Thank you. Thank you.